My name is Brian Purdy. I'm the Chief Technologist for Special Procedures for Steinberg Diagnostic Medical Imaging Centers. Once you've completed your registration, you'll be greeted by one of our caring and compassionate nurses. There you'll be taken back into the IR suite where you'll be changed into a gown and have your IV started.
My name is Yvonne. I'm one of the registered nurses here at Steinberg Diagnostic. My job for you and your family is to make sure that your stay with us today is comfortable.
At Steinberg Diagnostic, we take patient safety very seriously. We have state-of-the-art equipment, highly trained staff and doctors, and we're ACR and AAAHC accredited. We follow the same OR guidelines used across the nation. Hand scrubbing, hats, masks, gowns, and sterile gloves are used for your protection to prevent infection during each and every procedure. Next, you'll be taken into our angio suite, where you'll be situated comfortably on the table by a nurse and a tech. There you'll be hooked up to a monitor to monitor your heart and your breathing. Then you'll be sterilely draped and prepped and ready for your procedure. This is a great time for you to ask questions, as all the staff is quite knowledgeable. Once you're ready for your procedure to begin, you'll be taken care of by one of our skilled doctors.
When the patient is prepared and ready for the procedure, I enter the room and will introduce myself. I will give a brief description of the procedure.
We'll make sure you're comfortable. We have blankets and we have pillows. You'll be laying flat on the procedure table. I'll then come in and speak to you for a couple of minutes and ask you if you have any questions or concerns. The techs will then prep you and drape you in a sterile fashion, and while they're doing that, I'll scrub and gown up, put a mask on, and then I'll come over and talk to you again. We'll talk to you throughout the entire procedure.
Explain the procedure, answer any questions the patient may have. Throughout the procedure, I will be giving instructions and also describing what I'm doing so there are no surprises and the patient is fully aware of what's going at all times.
Many patients ask why we don't put our patients to sleep.
One of the advantages of having the procedure done in an outpatient setting is using conscious sedation as opposed to general anesthesia. General anesthesia is a process where the patient is put completely to sleep and they are dependent on a machine as well as the anesthesiologist for their breathing, blood pressure, heart rate. As opposed to conscious sedation, we give the patient a sedative as well as pain medicine to make procedures tolerable and make the patient sleepy and unaware of what's going on, but they're still able to breathe on their own. The advantage of this is it's much less taxing on the body. There's much less risk for conscious sedation, but we're still able to do many of the same procedures. Other procedures where you might get conscious sedation would be something like a colonoscopy or a bronchoscopy.
Once your procedure is completed, you'll be taken back to recovery.
My name is Stephanie. I'm one of the nurses here at Steinberg Diagnostic. During your recovery, we will minimize your discomfort and monitor your vital signs until it's time to go home.
We will give you clear discharge instructions as well as follow up with you the next day to see how you're doing.